China has rebuked the World Health Organization for what it says are irresponsible remarks over Beijing's zero-COVID policy. The Foreign Affairs Ministry reiterated that China is fully equipped and capable of achieving its zero objective. The WHO chief had called the current approach unsustainable and pressed for a change in strategy.
When we talk about the zero COVID strategy, we don't think that it's sustainable considering the behavior of the virus now and what we anticipate in the future. And especially when we have now a good knowledge, understanding of the virus, and when we have good tools to use, transiting into another strategy will be very important.
It is important to reflect on the fact that China's only had just over 15,000 deaths during the whole pandemic. So in that sense, China had something to protect. But all of those actions, as we've said since the beginning, should show due respect to individual and human rights. And we always have said as WHO that we need to balance the control measures against the impact they have on society, the impact they have on the economy. And that's not always an easy calibration to make.
Beijing has since censored those comments on Chinese social media platforms Weibo and WeChat. The government also reaffirmed its zero-COVID policy as an outbreak in Shanghai wanes under the approach. A new study by Chinese and American scientists also seemed to back the strategy. The report published in the journal Nature Medicine warns that more than 1.5 million lives will be put at risk if China drops its zero-COVID policy without any safeguards. Well, for more, Olivia Xiong joins us live from Beijing. Olivia, China has consistently stood by those tough measures, the ones that it's taken to try to get its way out of this pandemic. How is Beijing responding to the WHO's criticism now of its dynamic zero-COVID policy?
Well, pointing to how sensitive this matter is, China's censors have gone to work to scrub the Chinese internet, basically, of any of these comments that have been made by the WHO. We had seen on Chinese social media site Weibo that the United Nations had published a post with Mr. Tedros' comments, but this was made unavailable shortly after. On WeChat, the UN had also made a similar post, but this article cannot be shared. The function has been disabled and a video in the article has also been removed with the notification saying that it had violated the terms of use. And so we really see that there is sensitivity over this. Some netizens expressing disbelief that they aren't able to discuss these comments by the WHO online. Some even earlier had been questioning China's zero-COVID policy, while there were others as well who did say had hit back at Mr. Tedros' comments. But all this comes as we've seen Chinese President Xi Jinping make the call for the country to double down on its zero-COVID policy, even strikingly making a warning that any words or actions that may doubt, distort, or deny China's policy need to be fought against. And today we also see the Chinese Foreign Ministry hitting back at the WHO's comments saying that zero COVID does not mean zero infections, but what China is trying to do, it says, is to bring the pandemic under control as soon as possible in the shortest time with the lowest amount of social cost.
我们希望有关人士能够客观、理性看待中国疫情防控的政策，能够更多的了解事实，不要发表不负责任的言论。
Ollie, just why is China refusing to change its course in tackling COVID-19?
Well, China is saying that there will be disastrous consequences if it were to change course. Basically, in a study that has been published by Shanghai's Fudan University, it is saying that if China were to abandon its zero COVID policy and allow Omicron to spread, across the country, this could result in, quote, a tsunami of COVID-19 infections in the country, as well as up to 1.6 million deaths. And that is certainly of concern. And this major wave in the study, it said, could occur between May and July. Also, part of the reason that the study cited is the low vaccination rate of seniors here in the country. About 80% of seniors here have been fully vaccinated, but only about 55% have received their booster dose. And so with that in mind, the study is saying that this could put a strain on China's medical resources, with its ICU facilities possibly being 15 times exceeding its capacity that it's able to handle. But beyond the health considerations, there are also the political considerations too. This is a politically important year for President Xi, who is after his unprecedented third term in power at a key Communist Party Congress later in the year.
Ollie, thank you for that. Olivia Xiong there in Beijing.